The Physical Therapy Service at the VA Palo Alto welcomes you. We look forward to working with you to optimize your outcome following knee replacement surgery. In this video, we will review exercises that will help you regain range of motion and strength following knee replacement surgery. It is important for you to understand that these exercises are not just for after surgery. Doing these exercises before your knee replacement surgery will also help you to recover and improve your chances of a successful outcome. While you're in the hospital after knee replacement surgery, a physical therapist will evaluate your rehabilitation needs, assist with range of motion and strengthening exercises, and will provide you with an appropriate walking aid. We will now present the exercises that you will be doing while you are in the hospital after knee replacement surgery. Remember, all of these exercises can be done before surgery too. Perform quad sets while lying on your back with your legs straight. Tighten your front thigh muscle by straightening your knee towards the bed. Then hold it for 5 seconds before relaxing. Perform 15 repetitions 3 times per day. Perform leg slides while lying on your back with your legs straight. First, tighten your front thigh muscle. Then, slide your surgical leg side to side. Keep your toes pointing straight up. Perform 15 repetitions 3 times per day. Perform heel slides while lying on your back with your legs straight. Slowly bend your surgical leg to slide your heel towards your buttock. Use a strap, belt, or leg lifter to assist your movement if needed. Stop when you feel a moderate stretch, then straighten your leg. Perform 15 repetitions 3 times per day. Perform short arc quads while lying on your back with your surgical knee resting over a pillow or blanket roll. Slowly straighten your surgical leg until your knee is fully straight. Perform 15 repetitions 3 times per day. Perform ankle pumps while lying on your back with your legs straight. Pump your feet up and down throughout the day. Perform straight leg raises while lying on your back with your surgical leg straight and your non-surgical leg bent. Tighten the front thigh muscle on your surgical leg, then slowly lift it up while keeping the knee straight. Perform 15 repetitions 3 times per day. Perform hamstring stretch while lying on your back with your legs straight and supported at the ankle. Simply relax to let your surgical legs straighten for 30 seconds. Perform long arc quads while sitting in a stable chair with proper support under your thighs. Slowly straighten your surgical knee until it is fully extended, then slowly bend it back down. Perform 15 repetitions 3 times per day. Make sure you understand how much weight you can put on your leg before walking. Most patients having a routine knee replacement can put their full weight on their leg. Use the walking aid that is recommended by your physical therapist. Center yourself and maintain a comfortable distance from the walker while moving. Move your surgical leg first for comfort. Make sure you feel comfortable with weight bearing on your surgical leg before attempting stairs. Use handrails for safety. Remember, up with the good and down with the bad. Climb up the steps leading with your good, non-surgical, or stronger leg. Do not hold your breath. When going downstairs, remember again to use handrails for safety. Remember, up with the good and down with the bad. Come down the steps leading with your bad, surgical, or weaker leg. Do not hold your breath. You will need to continue physical therapy exercises at home after discharge. When you are at home, do all of the exercises you were taught to do in the hospital and that were reviewed in the prior slides. Add the following exercises when you are home. Perform quad sets while lying on your back with your legs straight. Tighten your front thigh muscle by straightening your knee towards the bed, then hold it for 5 or 10 seconds before relaxing. Perform 15 repetitions 3 times per day. Perform straight leg raises while lying on your back with your surgical leg straight and your non-surgical leg bent. Tighten your front thigh muscle on the surgical leg, then slowly lift it up while keeping the knee straight. Perform 15 repetitions 3 times per day. Perform knee flexion while sitting in a stable chair. Plant your foot down on the surgical leg, then scoot forward until you feel a moderate stretch on the surgical knee. Hold for up to 30 seconds before returning to a starting position. Perform 15 repetitions 3 times per day. We want your recovery from surgery to be successful. Doing these exercises at home every day after surgery is very important to achieve the best possible result. If you have questions about your exercises, you can call us at the number shown here. Thank you for watching our video describing the exercises that you need to do before and after knee replacement surgery. On behalf of the Physical Therapy Service at the Palo Alto VA Hospital, we wish you a rapid recovery and a return to the activities you enjoy.